name's Nathan Barnett. I'm an occupational therapist by trade. I'm one of the co-founders at SafeBalance, and today I serve as the Executive Vice President of the company. SafeBalance is a comprehensive, multifactorial falls risk assessment software designed for physicians in particular to assess various different risk factors of their patients that they see in their clinic. With that information, the physician is able to quickly and decisively identify underlying risk factors that may impact the overall pathway as it relates to that patient's plan of care. Various different elements are often overlooked when it comes down to fall risk factors. A lot of times emphasis is focused on balance and we kind of go overboard on balance, but there are other things that could come into play as well. Blood pressure issues, abnormal postural cardiac responses. And it's important to measure these things in a quick and detailed fashion and ensure that the patient is having the entire situation examined. We developed SafeBalance to really kind of check all the boxes as it relates to the payers, the providers, the facilities, the clinicians, and we really kind of felt that we hit our stride in terms of making sure that everybody is presented with the most detailed and important information as it relates to making a sound decision that's best for the patient. So SafeBalance has a variety of applications in numerous healthcare settings. The primary focus of SafeBalance really is to prevent falls using the CDC STEADY algorithm, but going beyond that as well. If we have the ability to identify the risk factors, we then can proactively mitigate those risk factors and manage that patient's care more efficiently. If we eliminate 3 risk factors in the course of a plan of care, we have the ability to then decrease the likelihood that a fall will occur in the future. SafeBalance has a unique capability of actually integrating into other service lines. So for instance, not only are we identifying the risk, but if we find someone that would benefit from physical therapy, we actually create the pathway to justify and support a focused physical therapy plan of care. Same thing with DME. Bracing is a high amount of evidence that decreases fall occurrences in the future. And by implementing, obviously, the justification for that bracing or identifying patients that would benefit from that from a medical necessity standpoint, we're able to drive that patient into those service lines if it is deemed necessary by the physician. But one of the most robust capabilities of SafeBalance is our back office analytics platform, which we provide to administrators and various different personnel within the organizations that we work with. So in this dashboard, we're able to disseminate specific fall risk factors that are sticking out in a region or in a hospital or in a clinic, such as blood pressure, such as pain, medication usage, prior fall history, and use this information to really kind of analyze and manage the populations that are served. So you're using the information provided on your own patients to create pathways, information, actionable items. In isolated case studies, we've seen SafeBalance in a mere 45 days decrease fall occurrences in assisted living facilities by 63% in one facility and 80% in another facility. By partnering with various different providers, we are able to have meaningful, low-cost interventions that really have impact on the overall picture and the landscape of the healthcare system. We are empowering our patients to take charge of their own healthcare and their own safety, given the tools to make slight environmental modifications, habit modifications, introducing strength and exercise programs. By showing that we care about the patient as a whole, it really shows the attentiveness and the holistic focus that our providers are engaging their clients with. Make no mistake, there are numerous fall prevention programs out there, but the one thing about SafeBalance is that we really wanted to focus on what is best for the patient, what is easily accessible for the provider, the client, to create quick action items. And so far, this is something that we have succeeded above and beyond even our wildest expectations. SafeBalance is definitely something that has a wide application and value to every single one of our clients that has implemented this in the program, and we would love to have the opportunity to discuss how SafeBalance can impact your practice, your system, your patients in the positive manner that everyone has experienced so far.